We have very strict criteria for who is a candidate for surgery. The criteria are slightly different for the gastric bypass and the lap band because the gastric bypass is a bit more risky. Okay, there are some complications unique to the gastric bypass making it a little bit more risky. So the criteria are a little bit more stringent for the gastric bypass. Now we base those on the body mass index. Not everyone out there knows what their body mass index is, although it's easy to determine. You can look at a chart, you can go on the computer and go to a BMI calculator, but roughly a body mass index of 35 or greater for the gastric bypass defines whether someone's a candidate or not. With the lap band, we relax that criteria down to a body mass index of 30. Now, if we were to do a rough correlation with what a body mass index of 35 means, that would be somewhere between 75 to 100 pounds overweight. Very imprecise, but that's a rough correlation. For the lap band, a body mass index of 30 can be roughly being overweight by about 50 pounds. With those numbers that we just mentioned, the patients generally have some medical conditions that are a result of their overweight, and that's also an element in how we decide whether a patient is a candidate for surgery or not. We perform this surgery because we expect that the risk of performing surgery is less than the risk that a patient faces if they don't do surgery. The risk they face with having certain medical conditions for many years that can decrease their life expectancy.